I'm going to give you a few strategies that hopefully will boost your confidence as you enter your first clinical settings and meet your first patients. This is why you went to medical school. When you enter clinics or hospitals, you're going to be wearing that short white coat that identifies you as a medical student, learning clinical medicine in real-world settings, such as physicians' offices, interdisciplinary multi-specialty clinics, or even on the hospital floors. Everyone in the healthcare workforce will know that you are a medical student. You're wearing that short white coat. That's good. Since medicine is a life and death decision-making profession and calling, and you are a medical student, you're going to need to gain that experience that we all gained while being closely supervised by our resident physicians, fellow physicians, attending physicians, and other members of the healthcare team. Your supervising doctors, your attendings, in addition to the teams that they lead of residents, fellows, and other students, have tremendously deep sets of expertise. Be ready and willing to follow the wise guidance and esteemed direction from your supervising physicians. Follow their lead. They really do know what they're doing, and generally, they're going to give you great guidance and direction. So what can you do individually to prepare ahead of time, proactively, to succeed from day one in these environments as a first-year medical student doctor? Number one, make sure you attend all of the scheduled orientation sessions that are set up by your medical school faculty to introduce you to these unique and even somewhat strange clinical environments. They will give you excellent orientation information on the expectations, plus all the logistics of where you're going to be, who you're going to be working with, maybe allay some of your fears and anxieties, and even more importantly, the goals for these sessions as you encounter your first patients. Exciting! Your deans are also going to remind you that there are healthcare rules and regulations, policies and procedures, which you know nothing about. I did not as a student either, but you're going to have to come to know, respect, and honor. Privacy expectations when you're working with patients, making sure you understand that you cannot share information out on social media about what you're doing as a student doctor. You're going to have to express your understanding of honoring confidentiality and recognize that you cannot share information from patient care contexts outside of clinical settings. There are regulations and rules as to how you're going to need to safeguard and protect patient information, with the electronic medical record, for instance. So go to these sessions, or you just will not be allowed to advance with your classmates into clinical settings. It's a high-stakes part of your medical education journey. Number two, this is really on you. Review the course syllabus for the clinical sessions in advance, as it's going to give you wayfinding navigational information in this new world and a lot of helpful, useful information on where to go, what to bring, and how to prepare. For instance, you're going to be expected to plan to arrive ahead of the scheduled clinic session starting time and know who you're working with and be able to introduce yourself confidently and comfortably as a first-year medical student working with Dr. Jones or Dr. Smith, and in that conversational manner with a staff member or an office manager or clinic director or nurse who might be working with that physician to whom you're assigned. Be gracious, respectful, and patient. They might be stuck in the OR. They might be at lunch. Number three, for these introductory clinical experiences, you also have interacted actively with the course material in advance, and be prepared to engage with your attending physician, that clinical preceptor, supervising you and teaching you for the day, whether it's learning how to communicate with a patient effectively, introducing yourself, or learning how to examine the lungs, or the heart, or the thyroid. Come up with a few questions that you'd like to ask your preceptor based on your reading in advance. Why do doctors examine the thyroid gland from the front or the back of the patient, with an anterior or posterior approach? Which approach is preferred for which types of patients? How do we better find the pulse in a young or older patient across the age spectrum? By asking questions with your student doctor colleagues, you're going to drive your learning and enhance the learning of your student doctor colleagues. So in summary, doing your best in clinical settings requires you to understand your role as a student doctor just starting out. You'll be working under close supervision of the team led by the attending physician, who's going to guide you through this whole new world of interacting with patients. Follow their directions, be respectful, be ahead of time. Your school is setting up you for success, but you've got to go to those sessions that they're tooling you up for in advance to use the toolkit. Prepare in advance, the course syllabus. Use that information and the content to study in advance. Engage with your preceptor during the sessions, and then you'll learn even more clinical medicine, which is going to help you with perspective in the basic sciences. What did you find the most useful in this video? Leave me a comment. When you think about all the time that you're investing as a young medical student doctor, take the time to review some of these videos and you'll find them useful. They're bringing years of experience in medical education, and I'm going to share the information that I wish I would have known when I was a medical student in your shoes and lacing up the boots to enter clinical settings. Thanks for watching, and until next time, enjoy these first experiences with patients. Stay well and study well.
So keep on learning, keep on growing, never lose your way. The future of medicine is brighter because of you today.